Hello and welcome again back to the Invisible Reality podcast. Today we're joined by a true pioneer in the world of integrative health, Dr. Sharon Montes, with a background that spans from medical director at the Maryland Center for Integrative Medicine to an international educator. Dr. Monte embodies what it means to be a doctorate teacher. She's a researcher, an educator, an administrator, and a collaborator and a healer, of course, blending Western science with traditional wisdom to empower people to make quality of life decisions. We are so honored to have you on, Dr. Sharon. I want to start with saying the background of you. Let's tell people more about it. You have been grown up by an artist mother, a scientific father. So, how is that formed your decision to go to integrative medicine before it actually came a mainstream?
Yeah, I was able to teach this stuff in medical schools before it was cool, when it was considered alternative. So I think in all wisdom traditions, we start with our past. So my ancestors, farmers, social workers. All right. So there's an orientation towards natural healing, good soil. Mom, dad, the scientist. So his nervous system processed things and it would come out in numbers and words. Mom's nervous system would process and it would come out in creativity, beauty, art, color. So she would had access to the nonverbal. So before going into medical school, I had to decide, do I want to work with plants or people? And I made a decision to work with people, but I was able to bring in natural healing and an orientation towards let's expand what our menu options are. I think also in terms of personal history, some of my early money making were babysitting, so working in the neighborhood. So caregiving was woven in. And also a waitress. So I paid for college by being a waitress. So in many ways, those experiences of these are your menu options. I can believe that you need a main course, but if all you really want is an appetizer or dessert, let's gently give you, just move you in the path towards healing. Educated, farmer, well-educated waitress.
That's an interesting background. Knowing you now, I can see the creativity, like
Yeah.
where it came from
Yeah.
and the innovation. That's awesome. You are already practiced as a holistic physician who integrates structure, chemistry, and energy in the way you listen and design care plans. How do the entheogenic medicine or life unify the overlapping domains of healing?
Thank you. That's a really good question. And I'm going to go back to it. But I'm also remembering in this idea of creating unity, the other from binary. So we got artist, scientist, and we are whole brain humans. My soul led me into doing thousands of hours of what Western medicine does well. I did my training in a regional trauma center where I was considered leftist and radical because I was advocating for lifestyle medicine. And so I'm going to get to the entheogenic, but I'm now in the space of this question. So we've got ancestors, childhood, adult work experiences, 16 years in academics where I got to create learning opportunities for this stuff that was just on the edge. So I'm becoming clear about the journey. It's the why is it that I care about entheogenic medicine and I'm so passionate? But so having trained in Western medicine, which is really good at keeping the physical body alive, it's really good at looking at the chemistry. These are the chemicals that make the heart work better. These are the chemicals that mean our kidneys are failing. So solid grounding in that Western medicine, physical, chemical. And then the month as I was finishing my training, my soul offered me the opportunity to take a community acupressure class. So this whole of Eastern relationship, balance, energy flows, and tracking the meridians on my body was an embodied experience. Oh, this hurts. This doesn't. That's weird. So the journey to entheogenic was Western, Eastern, recognizing it's all about restoring balance. Then the holistic of, now back to your question. Thank you. Your question helped me get more clear. Oh, this has been a journey to arrive here today.
Yeah.
So the blending of Eastern and Western are both required to help someone come back to balance, dynamic state. So holistic is body, structure, mind, emotions, chemistry, energy, heart rate variability, nervous system stuff, quantum physics, Star Trek medicine. We can diagnose and heal with light. And because I live in Colorado, I'm blessed with access of watching how different members of my community are advocating, teaching, proposing this psychedelic, which I really think of as entheogenic. In that circle of body, mind, spirit, those overlapping, entheogenic is where maybe the circle that pulls them together. Because entheogen is to find the divine within. Healing happens when we have right relationship with self, others, and all. And I use the word all to be non-denominational in the people I'm working with. And I'm really excited that because of all the research in psychedelics, there's lots of evidence. Maybe we have a vocabulary that creates a unified field of healing. Because entheogenic practices are all those things that people have done all over the world. Self-care, nature, breathing, sharing good food with people. Back to your question. Sorry, I have with it.
So how do you see that unify, like the chemistry and the entheogenic, like the scientific side, the Western medicine, the holistic, the entheogenic is unified for healing?
Yeah. So in this conversation, I'd seen entheogenic as the overlapping of all of them in the center, but I think I'm now expanding it. Entheogenic practices and entheogenic substances are ways of unifying and creating wholeness.
Okay.
And so the entheogenic practices we can also rename as lifestyle, which those of us who've been in the field for a while know are the foundations. Sleeping, eating, breathing, good
Yeah.
nourishment, stress management. What is our connection with community? Yeah.
So let's talk about the chemical basis of entheogenic medicine.
Yeah. And so I think for those of us who were trained to look at lab values, okay, and those of us who are functional medicine are not only just looking at a narrow limit, we're looking at optimal function in relationship to each other within people's bodies. It's not just you fit in this range, but are you in a range that supports your optimal function? And so if we think about entheogenic substances, be they man-made, L-ketamine, or nature-based, the mushrooms, the cactuses, the whole plant, each of them alters our chemistry. They tend to work on neurotransmitter chemistry. So, yes, the serotonin 2A, one that a lot of people think of, yet they work on dopamine, serotonin, norepinephrine, and we can get into the research, and then DMT. DMT is this molecule our body loves. Plants make it, animals make it, we make it. And it works on many different neurotransmitter, neurosynapse ways. So if we can, that gives us a quantitative way that may be part of the qualitative experience.
That's interesting. If that's just a question came to my mind. So if it changes the chemistry and it benefits our body, and it's like DMT is this amazing molecule our body creates, I'm assuming it helps with that, right? With producing
Yes,
DMT.
it's right in the way that, so as physicians, we are trained to think quantitatively and analytically. And
Yeah.
that is an important balance. English is quantitative language, math. Although actually when we get into calculus, things start getting fun. But all right,
Yeah.
DMT, a molecule in our life that is high when we are being born and when we're dying, is altered by some of these entheogenic substances. It is altered by extreme breath work, which is why
Yes.
some of these entheogenic practices also expand our consciousness. There's some people I know who are actually doing IV DMT, provide a prolonged DMT state, which through the chemical mediation affects our electro or circuits. We got a neuron, we got neurotransmitter, we got another neuron, we've got the structure, we've got the chemical, and then we've got the electrical transmission that happens with that. So I think part of what's coming to mind is in order to really adequately, and I think a lot of people do this, research the effects of entheogenic substances, we need more than just a blood test. And so
Yes.
if you look at some of the psilocybin literature, they're looking at spiritual outcomes. Was this meaningful? How did it transform your life? And comparing the entheogenic substances with standard Western, which we were trained. This is a psychiatric drug that works on these pathways, but also looking, because in the practice of entheogenic health, it's not just the exposure to the substance. It's after you've primed your nervous system to have change, because what we're doing is opening up the pathways that are already there. It's not making you something else, but how do we want to do the integration therapy? And how do we want to walk in life differently? Path, which gives me greater freedom, is the one that becomes my superhighway. So I think the research is not just pharmacological or the kinetics.
Yes.
It is also holistic research. What are the life outcomes? What is the inner world? How does that change?
So in a study, vocab, they call it longitudinal study. Like you actually follow the subject and see how their life changed, if there is any change.
Yeah.
Awesome. You've used meditation and integrative medicine for chronic pain. How might entheogenic medicine expand possibilities here? And what cautions should kept in mind?
So two things. I'm going to go from personal to professional. So when I was 15 years old, my family was introduced to a form of meditation that was seed syllable based. And so I would do that form of meditation. 20 years into that practice, I learned through neurofeedback, biofeedback, what was going on, science, let's measure, that what I'd been doing for 20 years was dissociative. That sitting still and thinking I was doing something wasn't leading to any physiologic changes. So there are hundreds of forms of meditation. Certain people's nervous system may do better with one than the other. So for me, I have to do an embodiment form of meditation. I have to move. I have to experience what's in my body. And in terms of working with other people, I encourage things that actually promote embodiment. And sometimes that is uncomfortable because they have to feel what they're feeling. Yet there is something about meditation, lifestyle, the entheogenic practices, breathe, observe, that is part of the healing journey. And if we now think about entheogenic substances, I have more professional experience with psilocybin. I've watched and listened. So what the psilocybin is doing, whether it's microdose, you don't have to spend 8 hours in the immersion experience of it. You can do a small amount that is also priming your nervous system to create new pathways. And if we look at the research, whether it's on ketamine, whether it's with psilocybin, whether it's with ibogaine, there is a lot, MDMA, there's a lot out there that shows how putting these substances in the body, the chemical change leads to electrical change, which can then lead to neuropathway change. My interpretation of the literature, though, is it is also maybe more important than catalyst of the psychedelic substance is what afterwards.
Okay.
How do you take that learning, that experience, and usually having someone walk that journey with you, support you as you're trying out new behaviors, new ways of, oh, if I let go of this pain, what happens? And it's also multidisciplinary. Having someone who's really good at myofascial, having someone 1 in 10 physical therapists, chiropractors, practitioners who know how to support the body in living with less pain.
It's like everything you do, it's not just one model. It's different models together. It's not like giving someone a pill and everything will be okay. No, you have to work on it, to work for being better, as you said, by myofascial chiropractor also.
Yeah, actually, I remember at some point in my career when I left urgent care and said teaching, practicing, being a model of what care looks like, there was a gut level, oh, great, because the model I was trained in, the pharmaceutical urgent care, can be linear. It can be simple. Okay, strep throat. I've got a history. I got a physical exam. I got a quick little test. I've got penicillin. It's nice. It's easy. I can help people relieve their pain relatively simply and relatively quickly. Yet, in my path, the people who came to me were the highly sensitives. They were having adverse reactions to pharmaceuticals. Things that I learned in medical school were not working.
Yeah.
So I had to explore, okay, here's Eastern medicine, here's Ayurvedic medicine, here's energy medicine. It's in the listening and having to find other menu options and a willingness to step into, I don't have the answer at this moment. Let's work together to continue to explore. And it's a lifelong journey. People keep coming to me, then I'm like, oh, wow, what are we going to do with that? And you're right. We're not taught to be comfortable with uncertainty.
Yeah.
We're not taught how to manage complexity. And that's why I think functional medicine, in its origin, we just had a variety of people who were trained to think and look at data one way, just applying it to new lab data.
Actually, sorry, go ahead. Yeah.
No, go ahead. No, I want this to.
When you were saying we were not taught, it came to my mind, actually, in our field, just our field, scientifically speaking, medically speaking, we're not taught to collaborate with each other's specialty. Like the internal medicine is, I remember this time an internist took a x-ray for my father's abdomen. So when I looked at the x-ray, that was a year ago. After a year, I looked at it and I'm like, how didn't he? So when you take an abdomen x-ray, there is a part of the lungs that comes with
the
it. Like,
diaphragm.
yeah, it can show a little bit. So I'm like,
Yes.
there is fibrosis. And he didn't tell the pulmonary doctor it's actually expanded. So in my mind, we're not taught to enmesh things with each other.
Yeah. Yeah, that's fascinating because I remember I did my training in a regional trauma center. And so as a young doctor, we're in the ICU and the cardiologist would say, well, it's a lung problem. Say it's a heart problem. And so here I'm at, this is a very complex problem and I'm working to support this person in staying alive. So this siloing of thought has strengths that can focus and it has weaknesses. So maybe the evolution of our field is interdisciplinary thought, communication, and action. Because in the pharmaceutical age, in the technology, in the age of preventing and reversing chronic disease, we need a multidisciplinary approach.
Yes. And we need to learn how to communicate to one another and put the pride aside. Like some doctors are like, no, I'm not going to talk to this specialty and I'm not going to talk to this doctor. And we need communication.
Yeah, because ultimately we're in service to our clients, to our patients, whatever we call them. More important is that they get served well.
And it's not a client. We look at most of the people who went to medical school want to serve humanity. They have a very pure goal. And then afterwards, I think with the burnout and everything and the frustration of them feeling they are not helping their patients because things that we learned might not work. They forgot their first goal or like their first reason why they joined.
This actually brings up a past memory of I was blessed to be able to teach integrative stuff, whether you call it alternative, complementary, integrative, for 16 years in medical schools. So I had a team and a culture and I was able to plant seeds. One of my most potent learning experiences for me was I was gifted a class in academics. You usually have to go to committees. So I taught a trimester class in integrative medicine, beginning of the semester to first and second year students. It was based on the NIH thing. Here's the energy. So it was very logical and I had evidence. What I watched is so it was this 8-week class or something. Within 2 weeks, those first year students had changed their openness to new information. Their nervous systems were changed. I remember third day of medical school, someone said, our job is to socialize you. And I said, not me. What I watched is in the first years, within 2 weeks, in order to survive, in order to thrive, they had to adapt their nervous systems to the systems and cultures that they were committed to be in for the next 7 to 11 years of their life. So it gave me, as an observer who was watching, listening, is wow, your nervous system isn't the same as it was 2 weeks ago. So we've got a system that we have to adapt to. And then we've got healthcare systems where we're going out to be of service and earn our livelihoods. So what I'm seeing is a group of maybe 40 to 50-year-olds who have that same passion to be of service, who went into this out of love.
Yes.
who have had to adapt. So part of what I'm thinking about this integrative stuff is I also had another transformational event where I got to, at the beginning of July, interact with maybe 200 integrative providers. They were at a conference in Colorado. So nurse practitioners, MDs, variety of letters, but they were all interested in integrative.
Mm-hmm.
And they were all doing something, be it working in jails, being at private practice. Most of them were employed by other people's, and they had the view that they needed to take courses or training or some other credentialing, or they had to be in a different environment to practice integrative health. And it really crystallized an idea is that if we are the medicine, it's our nervous system that influences those around us. Let's claim what we already know. Someone probably had a grandmother that gave them teas. Someone probably has a healing touch that they get information from the body. Someone, if they can claim that they are the medicine and that they can do integrative wherever they are. I just remember this nurse practitioner who had an amazing life history of what her military experience, what she'd healed from, and how she was showing up in the world. I just thought, you don't need any more diplomas or certifications. Just your presence and what you've chosen to live and heal through is healing. So somehow, and that's why I love Physician Transformation Institute, creating a safe environment for us to explore, wow, who am I as a result of what I lived through and as a result of what I'm having to do in the 3D world. So if we can fill up from the outside, maybe we can change those systems. And I know certain people can't recommend CBD or talk about the cannabinoids. So I know that there's systems limits. And just we're in a place of requiring some transformation. And that's why I love
I
what
think
PTI.
that the worlds of medicine is shifting globally. And for me, I'm talking like about myself. I'll be honest and admit I was scared of discussing my ideas and how I look at Western medicine, and because I will be the word ostracized from the medical community. But then when I joined PTI and everyone was talking, Nelson Chang, like a lot of medical people, dentists, nurses, like, oh my God, I'm not alone. And it was difficult for them. It's like stepping out of the closet. Like you're coming out and telling, I don't want that. This is not me. And I believe in this and this. And you have someone to back you up.
Yeah, community. That's how we
Yes.
heal.
Yes.
And that's what's really important. And and if I'd known that PTI existed when I was at that conference in early July, you can bet I would have just said, please go hang with these people. And wherever you start, it's fine and it's safe. It's safe to talk. It's safe to be seen and heard.
Yes, that's true. So I wanted to ask you about what do you see as the biggest misconception in both the public and medical community around the entheogenic medicine?
Yeah. And I'm going to alter because to me it was psychedelics.
I'll start first and say, I thought it's drugs.
Yeah. It's an escape. It's like, yes, absolutely.
You can get addicted to it and it's not, so that's what I thought.
And so let's start with kind of the bias. Want things to be safe. We don't know about them because we're sure not taught about them. I don't think most medical schools still aren't even teaching that we've got an endocannabinoid system. Oh, really? So yeah, it's a drug. And then it's addictive and low addictive potential. And it's a whole like these. Think about what we were trained to use. Then it's like this whole other field is like, It's safer than a lot of what I learned about in medical school.
Exactly. Yeah.
Yeah, professional bias. And then there's also an internal bias. They must be weak if they need to escape from reality, right? That what is this? It, so is it safe? Is it a good thing to do? And does it really work? Because we don't have any experience with
Mhm.
it. And so the idea of, and as doctors, a lot of these things are class 1 drugs.
Mhm.
So maybe privately we can use them in private use, but you keep that contained. So it's not, as a professional, you're going to go out in the world and say, hey, this is my experience and it's okay. You can't be advocates in many ways because you're confined in the square. And then as professionals, is okay, how do I get experience with this in terms of learning and listening to our patients and world wisdom? So it really is, it's a journey of having to learn. And so we start with information. Okay, so here is the science. If you look at the science on entheogenic substances / psychedelic medicines, there is amazing science about how these are really supporting chronic pain, depression, anxiety, mental health conditions that are incapacitating for people of all ages, all genders, all ethnicities, and sometimes working as well, if not better, than the medicines that we were trained to offer.
The funny thing is, I read about how it treated depression in many subjects, and you don't see this kind of news published. Or so it's not just professionally and non-professionally. It's an economic thing for pharmaceutical companies, I think.
Yeah. So, having worked in academics for 16 years, I saw what got published. I saw the bias, the journals that we were reading. So, I started really looking for other reputable sources in terms of, okay, what other kinds of evidence are they? And where am I going to learn other ways of being of service to my patients? So you're right. There is an economic bias in terms of what gets published and also what becomes a standard of care. And we don't even have to go into psychedelics. So there was really good evidence in the 90s about how to reverse and prevent cardiovascular disease. There's been evidence about how to prevent and reverse dementia. And the people who are creating that evidence are not getting published in the journals that we frequently read. The cool thing is, Alzheimer's Association, 20, 30 years after that start, is now publishing. We need
Yeah.
healthy lifestyle. And they're starting to do their own trials.
Yeah.
So truth is truth. And the wheels, but I'm really excited because I remember Alzheimer's Association in the past was really focused on lobbying for change, pharmaceutical interventions, research that was pretty much standard Western. They're now doing their own trials on the advantages of lifestyle medicine. So yeah, so I
So,
guess maybe there's maybe there's some value in being 20
yeah.
years ahead of the curve. It's, oh, there it is. Oh, there it's coming. Because I think some of the early adapters, I forget what the people who are for 50 years ahead of the curve, they get a little cranky if no one's listening.
Yeah, you feel like, yeah, sometimes you doubt yourself. You're like, am I the only one who's wrong and everyone else is right? But then when you have this high ethics, you wouldn't go with the flow just because.
You got your internal GPS systems.
Yes.
You got it.
You've been an educator, a researcher, and both researcher and educator. So, what research is mostly needed, and how can education empower both clinicians and patients?
Yeah. So let's go back to the fact. that it's nice there's differing levels of evidence. So as a clinician, I'm one-on-one, the stories over time. But as someone who also values the research and the systematic reviews, and it's okay, how do we integrate that? From my point of view, I really would like special attention to women, elders, disease, different ethnicities. If you look at a lot of the research in order to recruit mostly men of a certain ethnicity, I'd like, and which means we've got to expand our capacity to do not only quantitative but qualitative research. So I'm interested in learning from others in a bigger group on special populations. The other thing is involving the people. It's community-based research, right?
Yeah.
So if I am going to be wanting to learn about you, what do you want to learn about you? What do you want to learn about the effects of what we're doing? The participants in the study design. And then we go back to, as physicians, we're interested in protocols. What is the safety? What are the practices after entheogenic medicine that lead to greater outcomes? And I really want to honor MAPS. I think MAPS as a global organization is pulling together a lot of that to try and make it more accessible. What does this? We know Rick was really focused on MDMA, and that's what he's working with, both clinically, research, legislatively, to make this accessible. And then I think tying the research with education. So it's not just information, it's informing, it's empowering people. It's look. And honestly, having done integrative medicine before it was cool, I noticed that in medical school, a lot of what they were being taught was maybe 10 years behind what my people were actually doing. So the dying movement. There was a whole lot of hospice stuff out in the community before physicians were learning about it. So I would use my patients as ambassadors to their doctors. It's like, here's an article, here's a web link, as you were choosing to do this, that recognizing that the education is reciprocal, recognizing that it's not a one-way street, that we're all enriched. So I guess expanding the research from something that's in these journals to it's something we do every day. I think as a clinician, you also are learning and doing research as you're listening.
Yes.
It's the N of one. And how do we tell those stories? The whole levels of evidence we learn, expanding the concept of research from written to spoken to actual applications and community.
I like the reciprocal learning because we've been taught that we are the only one who has to learn. So that's a really valid point. We need a
It's
we need
humbling.
Dr. Sharon, like a lot of Dr. Sharon, many Dr. Sharon everywhere globally.
It's humbling. Here I am. I don't know how many decades into this journey. I'm still learning, and I'm doing some research on something I want to bring into the world in terms of protecting and enhancing brain function. And so I'm in my pilot stage. I'm doing screenings, right? I'm just using the technology, beta testing. And I've only done 8 screenings, and every single one of them, I was like, oh, what do I do with this? How do I respond to this? I think as long as we recognize that we're going to be constantly learning and we never know it all. And I think for doctors or physicians, that's hard. But I have been humbled so often in practice. I do everything the best I can, and sometimes things still go mucky.
I feel it's a personal choice.
Yeah.
Yeah, it's a personal, it's the ego.
Yeah. And actually, that is another phrase somewhere I picked up. It's eco over ego. If I'm part of an ecosystem, I am only one piece. Whereas if I'm coming from ego, that is just about me, that doesn't serve the greater good. And so that's a catchphrase. Okay, eco. They're part of this. I like co-creating.
Given your work with women and elders, what unique opportunities and relation and responsibilities do you see for entheogenic approach with this specific group?
All right, let's start with women. I love working with women, and something about finding the divine within, relationship with self, others, all. So, because entheogenic is done in community, and many women are pillars, weavers of community, whether they are the providers of the practices, there's also the holders of the wisdom and the medicine, not to ignore the male gender, yet there is a certain quality of grandmother wisdom that is important to bring into our everyday life. And so there's a certain form of grandmother leadership that looks different. It is eco, it is collaborative. And also for women, if we look at some of these entheogenic practices and substances, trauma in Colorado. So actually, it's also vets. Years ago, I wrote a blog about the similarities between being a mom and being a warrior. That the idea of you are committed to life and you will give your life, you will give up sleep, you will protect, you will provide, because that's part of the mission of being a warrior and being a mom. And for me, slide change, and I'll get to the elders, but those instructions, put your air mask on yourself before you put it on. I'm sorry, that
It
has
doesn't.
never worked.
Yeah.
It's an intellectual thing. My heart and my gut are going to provide care for the elders and the kids. And so there's something about the entheogenics. How can we do it and have resilience as we're doing it?
Yeah.
So that we don't become all self-sacrificial, but there's this balance. And so the entheogenics in helping create greater resilience and balance, and maybe other tools. First responders are first going to secure. They're going to make sure there's no water and electrical lines. So there's a sense of, okay, create safety in the environment. But so for women, and also back to in Colorado, one of the indications for mushrooms is PTSD. So,
Yes.
and that's what triggered the idea of the vets. There is this amazing community of vets who are already doing this. They know this. They are going to help their brothers and sisters. They're growing the mushrooms. They're distributing the mushrooms free. They're doing the facilitating. I guess it's women, it's vets, it's our warriors, it's our people who have done combat. And you didn't ask this. We're still going to get back to the elders, but the vets are a special population because as an observer in Colorado, I see, I don't want to call them the extremes because I really think yin yang, but we'll say you've got the glittering pink pony. This is fun. And then we got the people who are the warriors who are really using this and really transforming themselves and their communities.
Yeah.
So I'm curious and supporting the evolution of this medicine as integrating into the standard of care. Now, back to your question. Thank you. The elders. I think it's really important, even though these are considered frail and special populations, given that elders are going through amazing transformation, the loss of mental, physical, social resources, and having to continue to cultivate resilience and stay coherent in the midst of transformation. An amazing part. Of course, how do I create new nervous systems? How do I rewire to adapt to this decade versus 3 decades ago? So transitions through life. Also, there's an amazing amount of research, some of it qualitative, some of it quantitative, about use of entheogens at end of life. It's dramatic. That once again, it's adapting the medicine to the person. So is it a microdose? Is it a big dose? What is it? Psilocybin? Is it ketamine? There's a variety of options for matching the medicine to the person's involvement.
So my question is, how does it benefit the end of life patients?
So what happens is we can remember the Kubler-Ross things in terms of stagings, or we can look at different wisdom traditions that we go through stages. So if part of what the entheogenic does experience is it opens up our nervous system, new ways of thinking, new ways of being, and that living each day in preparation for death is the warrior way. But let me have some insights. And the other thing is, let me defrag my nervous system. I don't need to go into this sacred chapter of life all tangled up by past stuff that I can't influence. So I'd say many ways in terms of forgiveness of self and others. It's okay. It is what it is. And I will have peace. So maybe some equanimity, as well as depending on where people are in their personal relationship with awe, something here, because entering, to me, the challenge as a healthcare provider is supporting people in dying. When you've actually got the death, and this is my last breath, everyone's journey is different.
Yes.
So to offer someone something that can, if they have, I'm not working, to me, spirituality is people's unique sacred connection with all. So if through offering them some chemical transformation, it opens up doors, as Huxley said, doors of perception, are creating a different experience around the hospice experience. We're creating opportunities that may not otherwise exist. Yeah.
So how can entheogenic experiences be integrated with meditation, mindfulness, or lifestyle practices to deepen outcomes?
Yeah. So as someone who has wasted thousands of hours listening to people, lecturing people, coaching people about how to change their habits, I really have accepted the reality of James Maskell's stake in the ground. Doctors are not the best coaches. And so if we know that the most effective thing we can do as doctors is to help people change their habits, it's not a blood test. It's not a procedure. It is creating the environment and the circumstances for people to take sovereignty and create systems of accountability for changing their habits. And the entheogenic practices are all of that. I love the 4 tendencies quiz. Is okay, if you want to get from here to here, something's going to have to change. So what do we want to do to work with you specifically to help you make that change? And different people, about 50% of people do much better with accountability. Some people are just rebels and they just have to remember why they want to do it. They are their own worst. So the entheogenic practices, get in nature, connect with people you love. This is, if we want to use Vegas stuff, this is healthy co-regulation. Do things with others that are healthy. Then there's also the self breath work. My breath is with me wherever I am. So I'm going to use that. Taming the monkey mind. So I've got a rampant monkey mind, which is why I think my life path took me towards meditation, because I observed it. So I don't have the goal that sitting on a chair and being quiet is really any way to anything for me. I have to walk wide open, observe. Oh, bring in the monkey mind, leash it, I tame it. And that is what entheogenic practices and substances can do. It's, oh, wow, do I really want to live with that person? then we've got all of the mindfulness in body. Be with your senses.
You say entheogenic practices, just to be clear for the audience, you don't mean just entheogenic medicine. It's a whole different lifestyle or like practices. Some of the patient, do you think some of the patient who would come needs entheogenic medicine and some of them don't, or all of them?
Yes. Yes. No. And that's why I really want to be very clear that I have used the word lifestyle medicine for over 30 years. I was part of that whole founding thing. But I like entheogenic, find the divine within. It is your sovereignty. But genic practices are things that are accessible anywhere to anyone, right?
Yes.
And it doesn't require an expert. You are your expert. Your community is your expert. Just keep moving in the world with that point of view. So lifestyle medicine doesn't have to be just, oh, something else to do. I got to eat better. I got to exercise. I got to sleep. I know that. So it's practices, but then there's the substances. And that's where the regulatory thing becomes in, because marijuana is medical and regulated in most of the United States. Still questionable community access, like the neighborhood, the friend. And some of these, yes, Oregon and Colorado are creating regulation mushrooms. So to me, the question then becomes the entheogenic medicine. How do we create greater, safer community access to this? Since many of these medicines have been used around the world for thousands of years. So that's why I'm dividing them. Because to me, entheogenic practices, anyone has free access to. Entheogenic medicines, still we haven't expanded accessibility. And
Yes.
so that's why I divide them out. And yeah, so fine. If you're in Johns Hopkins, you can take psilocybin in a 25 milligram capsule. If you're in South America, you've got a lot of people who grow it and it's already accessible in your community. So that's why I'm dividing them. Does
Yeah.
that make
Yes,
sense?
it does. It does. Yeah. Thank you.
Yeah.
So your motto is provide learning, empowers people.
Yeah.
How do you see the role of patients shifting as entheogenic medicine becomes more mainstream?
So I'm between the generations of people who absolutely honored their doctor. The doctor has information I don't have. The doctor is the provider of the pill or the technology that will allow me to live better. So there is a generation of people who lived through, there was no penicillin, there is penicillin. There was
Mm.
intensive care, there is intensive care. And then there's another generation that's we lived through that and it's very expensive and we're not sure it really actually helps chronic disease. So as a bridge between those generations of medical care, I think I go back to my former ancestors, country resilient, that the earth provides a lot of healing medicine and experiences. So before there was penicillin, there were herbs. And I'm not saying to get rid of medicine, but we've
No.
got to come to some balance. And if we look at healthcare in the United States, despite all the money we're spending, we sure don't have great quality indicators compared with people around the world. So there's something that's not working based on all of our technology and all of our money. So let's come up with something that allows women to carry pregnancies to term. And so this is socioeconomic, it's multifactorial, but the idea is one-on-one, if I can drink my nourishing herbal infusions, it's low cost and it's something I can do, self-care. I think getting everyone with a basic foundational level of self-care and community care, my home becomes a healthy home for the community. And I think that's what I really saw during COVID. That if one person would say, hey, I've got a nebulizer, the other person would say, I've got this. So it's not just personal sovereignty, it's local sovereignty, and it's community health at its best. It's stone soup. Everyone contributes a little bit so that the neighborhood is healthy.
I remember Dr. Chang says once, it's where now we're shifting of the patients used to see the doctor as the hero.
Yeah.
But the doctor is not the hero.
No.
You're the hero.
You are the center of your healing experience, and helping people remember that, but also give them the experiences of it. So, and it's a co-creative thing. It's a partnership. So yes, I am blessed. I have a lot of education, and I can talk with you about how your mitochondria work and how cool the ATP is. And I can describe what's really the miracle of what's happening. Yet it's still yours to choose. What are you nourishing yourself with mentally, physically? Yeah.
Thank you so much.
Yeah.
Thank you. Thank you. And I want you to promise me this recorded. We're going to have another podcast together because I'm not done with your knowledge. Well, and you have so much to provide for people. And I feel like when you were talking, I feel like, oh my God, Dr. Sharon is this treasure where you open Pandora box and she has so much to give. Thank you. Thank you so much for your time. And
I appreciate your questions, even if I went off, but this does relate to that.
No, but it makes everything connected. I'm blessed to have you in my life. That's all
I'm blessed to have my life.